So our first presentation will be a video. It is a randomized placebo-controlled study of magnetic acupuncture for supplementary analgesia after laparoscopic appendectomy for children, presented by Dr. Muensterer. He is standing by in the chat, or excuse me, in the Q&A, so please put your questions in the Q&A and he will be more than happy to respond to them.
Hi, this is Oliver from Munich, and thank you so much for the opportunity to present our study on magnetic acupuncture for supplementary analgesia after laparoscopic appendectomy. We have no disclosures, however, the study was supported by a grant from the Eden Foundation. So acupuncture has been a part of traditional Chinese medicine for over 2,500 years, and there's growing evidence that acupuncture may be helpful for certain pediatric procedural pain. However, there's few randomized controlled trials, if any, and only some with very little statistical power. Recently, magnetic acupuncture has described as an alternative, and in fact, there's a study that shows that magnetic acupuncture may decrease pain during infant heel pricks. So because kids don't like needles, we believe that magnetic acupuncture is ideal for the therapy of children and adolescents. So the purpose of this study was to evaluate magnetic acupuncture as an adjuvant analgesia after laparoscopic. So we recruited children at an age of 2 to 18 years who underwent single incision laparoscopic appendectomy for acute appendicitis throughout a 2-year period. And we randomized them in 3 groups. One of them got standard analgesia with magnetic acupuncture. A second one got standard analgesia with a placebo metal disc, but no magnetic properties. And the third one was standard analgesia alone, consisting of acetaminophen, ibuprofen, and an opioid, PRN. So first we had to get the attendings and the fellows and the residents to be able to place the magnets after their operations. So we had a lot of fun doing acupuncture workshops, telling them exactly where those points are. We had instructional videos, and we even had a marked model in the OR so that nobody would forget and that we would reliably place them where they had to go. And we assessed the postoperative pain every 4 hours for the first 24 hours with visual analog scales and validated instruments. And then we also recorded the cumulative dose of PRN analgesics over the hospital stay. And finally, everybody filled out a survey at discharge on their experience with magnets or without. So this is the CONSORT diagram. And over the study period of 2 years, we randomized a total of 126 patients, leaving over 30 patients to be analyzed in each group, which was important because that was the threshold for adequate statistical power. These are the results. So strikingly, there was a mild placebo effect, but the effect of the magnetic acupuncture was much more pronounced and even more significant and showed a more significant analgesic properties than the placebo. We also saw this with PRN pain medication because there was a significant lower amount of PRN analgesics that were prescribed in the magnet group compared to placebo or the controls. Concerning the survey, all patients were very satisfied with their treatment. And most importantly, we didn't see any complications such as ingested magnets or anything like that. So in conclusion, supplemental magnetic acupuncture after laparoscopic appendectomy may decrease post-op pain perception and on-demand analgesic requirement. These effects cannot be explained by placebo mechanism alone. And therefore, we believe that this is a simple, non-invasive intervention that really can be performed by anyone, and it is very safe. So we believe that further studies are warranted, and I'm glad to take any questions. Thank you so much for your attention.